Good morning. I'm Dr. Mark Dowell. I'm an infectious disease physician and Natrona County Health Officer. Have been here for about 30 years now. Seen a lot of trends in infectious diseases, and I want to talk to you about how important it is to learn about respiratory syncytial virus, which is known out there as RSV, what effect it's having on our community, on our daycares, what the status is now, and what we can do about it. We're seeing some concerning trends. I want to explain them and how you can play a role in helping our little infants. Respiratory syncytial virus is a virus that is extremely contagious. It can be seen in adults and in little kids, but kids of any age. And it causes anything from a snotty nose to shortness of breath, to a major cough, and in kids that are not healthy to begin with, let's say they have severe asthma, or they have heart disease, or there's something wrong with their immune systems, it can become severe and can lead to death. There are about 2.1 million office visits in the US every year for respiratory syncytial virus. That's a lot. Many more parents don't bring their kids in when they have the snot nose, so I think that number's low. Of those kids, 1% to 2% will be hospitalized. So that's 51,000 hospitalizations per year in the US. That's a big deal. There's no vaccine for respiratory syncytial virus. I'm going to continue to refer to it as RSV. And so what does it really mean for the community? How is it spread? Those kind of things. Well, COVID changed everything. So last year we put in a mask requirement in the county when COVID was rampant. And I will let you know COVID is rampant now with actually more hospitalizations than we had last year. So it is even more aggressive and different than it was. So last year we put in this mask ordinance, and guess what? We did not see a single RSV admission to Wyoming Medical Center at all. And in fact, for the first time in the 30 years I've been here, we didn't see anybody with influenza admitted. Why was that? It was due to the masking and strict hand washing. No question about it. So what's happened this year is that our hospital is full of RSV on the pediatric ward. We're seeing 6 and 7 little babies, generally less than age 3 and many less than age 2, hospitalized with RSV, when we didn't see it at all last year. What's the difference? Masking and hand washing and social distancing. You're sick of hearing about it, but these simple measures have changed the game again, and I think we'll see a lot of influenza in the hospital this year for the same reason. The community's not masking, not social distancing, and so we're seeing this increase. Nothing else is really going to explain this. So what happens to these kids when they get hospitalized? Well, mom or dad know that their kid is getting sick. Now, kids are contagious with RSV a day or two before they get sick, so this is easily spread. The real flu is contagious for 24 hours before you get symptoms. RSV 1 to 2 days. So what happens is these kids that are hospitalized start panting. They become much more short of breath, and parents look at their kids and say, this isn't normal. My kid's short of breath. I better go get them seen. A lot of times they bring them to the emergency room or to the pediatrician or family doctor's or nurse practitioner's office. They see the kid fairly sick. To the ER they go. The test is run, which is a nasal swab, very accurate. They're diagnosed with RSV. If they look really ill or their oxygen levels are borderline to low, They're hospitalized until they're better. They give them oxygen, sometimes mist tents, once in a while a breathing treatment. But there are not really good treatments for it unless there is a kid with severe illness or a kid that has an immune problem or heart disease. Otherwise, it's time and watch and oxygen. Now, how do these kids get this? Well, it's very, very contagious. Adults can have it. They may not have symptoms. They may have a common cold and they don't know, and they're taking care of their little baby, and that's the end of that. And sometimes they get sick, or they have siblings in the house that have it, and it easily spreads within a family. Which, you don't want your kid hospitalized. We don't want the pediatric floor full of RSV, because some of that can be prevented. In the past, we'd always have a few kids occasionally with RSV, but this is unusual. This is more than we normally see. And so it's very concerning. But what's interesting is we can make a difference as a community and as providers to break the cycle of this. So how do we do that? Well, it's a respiratory virus. So one of the things we want to talk about is daycare and home care. Adults can play a huge role in keeping these kids from ending up sick in the hospital. RSV can also go to adults that have immune system problems and put them in the hospital. So this is not a Mickey Mouse kind of situation. So what happens at daycare? What can you do? Well, if all the providers mask and wear gloves when they need to, although it's tough when you're taking care of little kids and wearing gloves. It's not that warm, touchy-feely situation. I understand that. You wash your hands or use hand gel frequently. You wipe down surfaces with disinfectant. You wipe down toys. You stay very compulsive about wearing your mask. The spread goes down a lot. Now, what happens with the parents? The parents notice that their kid's sick. You don't send them to daycare. I'm sorry, I know you may have to work, but they should not be there because they'll spread RSV to other kids. Now, there are lots of other viruses, and you may not be able to make any differentiation as to what it is, and that's really not your job or your expertise. So, should a daycare provider, if they're sick with a cold, be at work? No, they should not. Why? Because they can spread this to little kids. And if they happen to, as an adult, have RSV, they can give it to the little kids, and some of them may be hospitalized. Let's go back for a second to talk about 1% to 2% hospitalization rate nationally for RSV. Look at the size of Casper in Natrona County. We have 6 or 7 kids hospitalized. Look at that percentage. What does that tell you? There is a ton of RSV in our community right now, a ton of it. Otherwise, we wouldn't see those hospitalizations. So as a daycare provider or a home provider, you can make a difference. I advocate and strongly suggest that you wear masks while you're wear a mask while you're working in daycare from the time you go in till the time you go home. I have to wear a mask when I take care of patients. I get used to it, I don't really care. I just wear a surgical mask. Do I wash my hands or use hand gel between patients? Of course I do. Would you want me not to? Well, what's the difference between that and taking care of little babies? Nothing. So if you want to keep this from spreading in your daycare, keep your daycare full, keep your kids safe, no one comes to work or no little kid goes there if they're sick. Parents have to be honest about that. And then if you identify a child sick at daycare during the day, they go home. But the providers wear their masks, wash their hands, are very careful, And maybe you set up a system within your daycare that cleans the surfaces on a regular basis. If you do those kind of things, we can stop this in its tracks, because we don't have a vaccine like influenza. And so we don't have a lot of other options. So my message to you today is that you can make a difference for your community. Because I don't know about you, but it tugs at my heart when I see a 6-month-old, a 1-year-old breathing 30 and 40 times a minute, laying in a bed in a mist tent in a hospital bed. Hard on the parents, it's hard on the child. So do your part, take this seriously. Don't think doing it part way will work, because it won't. It just takes once. Please do this for our community. Have a good early winter and do the right thing.
Hi, my name is Andy Dunn. I'm a primary care physician and a member of the Natrona County Public Health Board. I'm here today to talk about respiratory syncytial virus, or better known as RSV. As a clinician, we see kids presenting with RSV type symptoms, usually late winter into early spring. It actually can affect adults as well, but the severity really is more pronounced in kids, and especially babies. The infection can last anywhere from 2 to 8 days, but symptoms can last up to 2 weeks. And what can start out as upper respiratory symptoms, such as sore throat, nasal congestion, can progress into an infection and inflammatory change in lungs, specifically called bronchiolitis. Just a fancy way of saying that the air tubes in our lungs become inflamed from the virus. And this is troubling for babies and young kids, as they already have small airways. When that inflammation occurs, there's more mucus that can surround the air tubes and actually even plug the air tubes. And so a lot of times, if the kids aren't presenting with cold-like symptoms, they're presenting with deeper respiratory symptoms, meaning a dry, hacking cough, and even more troubling, difficulties breathing. Sometimes you'll see fast breathing in young kids, usually under the age of 3, very pronounced in infants, but you'll see fast breathing, very labored breathing. And labored breathing can be something as small and noticeably as the nares or nostrils flaring upon inspiration and expiration. It won't look quite right, and that's usually a sign of difficulty breathing. And in babies, you can also see retractions. And retractions are a scary thing as well, in that with the ribs exposed, you can see the abdomen and the tissue around the ribs being sucked in a way that doesn't look quite normal upon inspiration. It's quite dramatic in babies and infants, and again, a troubling sign. So again, what starts out as an upper respiratory infection, usually sore throat, nasal congestion, a copious nasal discharge, can progress to lower respiratory symptoms. You should seek the advice of a medical professional, especially when the breathing becomes more pronounced, more labored, more difficult. There are several things that we can do as clinicians. Sometimes it's just as easy as suctioning mucus through the nares with a bulb suction in babies and infants. Can't really do that in kids 2, 3. It's a little bit harder, but still can be done. And you can also supplement with oxygen if needed as well, because sometimes with the inflammation in your lower airways, you can become hypoxic, just a fancy way of saying low oxygen concentrations in your blood. So sometimes kids, babies need oxygen supplementation at the clinic, and maybe even to go home with, or even need to be hospitalized for further oxygen care. There are some treatments that also correspond or we use with asthma exacerbations as well, or reactive airway disease. And that's just a way of describing how a child or a young person is very wheezy upon inspiration, or has coughing fits. And that can, again, be from an inflammatory event such as the RSV virus. And that can be treated, the wheezing can be treated with a nebulizer a lot of times. Harder to do with an inhaler because of the age, and it's difficult to time the inhalation with the medication. So nebulized treatment's usually the way to go for that wheezing component of what RSV can lead to. In the very severe cases, infants, young children have to be hospitalized to better monitor their respiratory difficulties and ensure that they're receiving enough oxygen. Hydration also becomes an issue. One of the big things when we're not feeling well is to keep hydrated. Very, very hard to do with a baby or an infant. So outside of the respiratory difficulties, sometimes babies, infants will need hydration as well. And that needs to be done at the hospital if it can't be done orally. What we're seeing right now in Natrona County is an increase in RSV cases early in the fall season. We normally don't have these many RSV cases in September and October. We're seeing an increased number of RSV cases at the hospital, which again is not very common. Usually late December into January, February, March, but not September, October. And so it's very, very important that we do everything we can to help mitigate the spread of RSV. RSV, much like coronavirus, can be spread by respiratory droplets, aerosolized particles, or on surfaces. So do everything you can to mitigate that type of spread, that contagious spread, so we can prevent our kids from getting hospitalized. RSV is the #1 reason why kids under the age of 1 are hospitalized. And so it's a very, very real deal, and it's unfortunate that we're seeing such a high volume of RSV cases at this time in October. And unfortunately, because we are in a pandemic still, and with the Delta variant of COVID, with the increase in cases that we're seeing, not only in the community, but in the hospital, even more so than last fall, hospital resources are stretched. The providers are stretched both in the outpatient and inpatient settings. Your pediatrician is seeing many respiratory cases in the clinic. And unfortunately, the pediatric hospitalists are seeing very many cases of respiratory diseases in the hospital, whether it's COVID related or RSV. Everything that we can do in the community setting is important, as it is a domino effect towards the hospital. Pediatricians are seeing an increased amount of patients with RSV. Primary care providers are seeing an increased number of RSV patients. So the more that we can do to reduce the number of RSV patients in the community, the more steps that we can take to mitigate that contagious spread of RSV, the better our community has at providing all the resources available for all the patients at our hospital and at our clinics. Healthcare providers are extremely busy in both the outpatient and inpatient setting. So it is of the utmost importance that we do our part in the outpatient setting with simple things such as washing your hands, staying home if you're sick, keeping your distance, wearing a mask, get tested for respiratory symptoms as indicated by your provider. The more steps that we can take to be cognizant of what RSV is and how it spreads and what it looks like, the better we can keep our children safe, healthy, and offload any potential stretch of health care resources in our community.